Managing individual risks in relation to underlying health conditions and multimorbidity. Both versions of the risk reduction framework that our NIHR ARC East Midlands team have helped to develop highlight the increased risk of developing more severe COVID-19 symptoms and outcomes if someone has an existing illness. Our work has shown that people with comorbidities, which means having more than one health condition at the same time, including hypertension or the high blood pressure, diabetes, cardiovascular disease or heart disease, which includes the narrowing of the arteries, which could lead to heart attack, angina or stroke, chronic obstructive pulmonary disorder or COPD, where the lungs become damaged or inflamed and lead to breathing issues, chronic kidney disease or CKD, where the kidneys stop working as well, and cancer, are known to have a significant higher risk of developing COVID-19 and carry a higher risk of mortality. This means that it is vital that everyone is able to assess their own risk of developing COVID-19 and take steps to minimise this through social distancing, wearing a face mask and carrying out good hand and respiratory hygiene. Sadly, we found that because of COVID-19 pandemic, many people with chronic diseases have experienced a reduction in the healthcare services and the level of support available to them. Some routine care has not been provided or has been replaced with telehealth care options such as virtual appointments using video calling or the introduction of self-management strategies. However, this is not a suitable option for everyone and leads to inequalities in access to care, as well as negatively affecting the management of existing illnesses. Over the years, our ARC teams have become experts in developing knowledge about how to offer routine care through online methods and designing self-management programs. We've included some links to our available resources below this film. Both versions of the risk reduction framework identify having underlying health conditions as leading to an increased risk of COVID-19. Our team has found that there is an even greater threat for people from a minority ethnic background. Insulin resistance, cardiovascular disease, obesity and psychological stress, chronic infections and genetic predispositions are all factors that may contribute to a higher level of physiological inflammation in the body, which can lead to more severe COVID-19 symptoms. We've also found that obesity is a risk factor for COVID-19 hospitalisation in the UK, with an increased risk for people from a minority ethnic population with a BMI of over 30. Our work has shown that people with type 2 diabetes that come from a minority ethnic background are more than 2.5 times more likely to develop COVID-19 than their white European counterparts. The ARC East Midlands team have contributed to both of the NHS England COVID-19 diabetes reports, which found that all types of diabetes infer an increased risk of developing in-hospital mortality due to COVID-19. The first report suggests that up to 1/3 of all hospital deaths thus far in England have been attributed to the combination of COVID-19 and diabetes. The second report suggests that the combination of poor blood sugar control and a high BMI of over 25 in people with type 2 diabetes is linked to an increased risk of COVID-19 related mortality. It is therefore most important that people with diabetes manage their risks and take steps to reduce their weight. If you or someone you know thinks they might be at risk of developing type 2 diabetes, you can now access the diabetes risk score that we've developed. This can be found on the Diabetes UK website. We've added a link to this website below the video. Once the risk score is complete, if you or they are found to have a moderate or high risk of developing diabetes, you or they will be referred to the Healthier You programme, NHS England's diabetes prevention programme, elements of which we have contributed to.